Hello, everybody. Rob Wallace here, Evolutionary epidemiologist. I'm going to present a section of the People's CDC weekly COVID report that didn't make the cut, in part due to our limited time slot. But I thought it important enough to present these comments on my own channel. As such, these are my comments alone. The Biden administration and politicos of both parties are treating COVID as if the pandemic is over, moving on to other crises, including Ukraine and, suddenly, the Supreme Court's reversal of Roe v. Wade. Clearly, war and access to reproductive medical care are key problems in public health. But the political class's objective is to return to the business as usual that, while lucrative for a few, helped produce the pandemic in the first place. And, in fact, given many of the CDC's changes in COVID policy, including reducing recommended quarantine from 10 days to 5, helped prolong the pandemic here in the States. The ramifications are obvious beyond just the virus's fortunes. In his recent commentary in the New York Times, Herman Lopez reported, quote, "Polling suggests that COVID, not the chaotic U.S. withdrawal from Afghanistan, jump-started Mr. Biden's political problems. His approval rating began to drop in July, weeks before the withdrawal. That timing coincides," Lopez continues, "with the rise of the Delta variant and reports that vaccine protection against infection was not holding up. Both came after Biden suggested for months that an Independence Day from COVID was near, setting up Americans for disappointment as it became clear that his administration would not fulfill arguably its biggest promise." End quote. Chief Presidential Medical Advisor Anthony Fauci continued along these lines, his almost perfect record of both brightsiding the U.S. outbreak and backtracking upon obvious rebuttals, whether by critics or by the virus itself. And he has done so repeatedly over the course of the pandemic. On the other hand, in attacking Fauci on fallacious grounds, the right wing ends up supporting such flaccid leadership, if only by representing a more public health adverse alternative. No, this article here isn't satire. An opposition along the lines of congressional candidate John Bennett threatening to assassinate Fauci, or Senator Rand Paul's personal attacks on the Senate floor, offers Fauci repeated cover for gaffes that, in actuality, in pinging back and forth between brightsiding and backtracking, serve in managing the American people's expectations that all is well despite the CDC's own evidence to the contrary. It's part of a bigger problem. Washington's ruling class is so intent on forcing COVID off the page that it insists on engaging in demonstrations of abject faith as pernicious as snake handling. In this case, attending reconvened galas without masks, even as 42% of U.S. COVID fatalities in January and February occurred in vaccinated patients. The April 3rd Gridiron show at the D.C. Downtown Hotel served as a superspreader event with at least 70 attendees infected. Those infected at the Gridiron included Speaker of the House Nancy Pelosi, who would kiss the president in the days that follow, but also Attorney General Merrick Garland, Senator Susan Collins, and Representatives Elaine Luria and Joaquin Castro, Commerce Secretary Gina Raimondo, and Representative Adam Schiff, among other people. Less than a month later, the ritual was reenacted at the White House Correspondents' Dinner, as if no mistake at all, given the Gridiron fallout. As Eric Fagolding posted, a carbon dioxide concentration meter a reporter took to the White House Correspondents' Dinner showed CO2 of over 2,000 parts per million, which is over 5.5 times greater concentration than outdoors. Ventilation in a closed-off ballroom isn't an option, and perhaps the very point. Willful risk turns into ritualized bravado. Jonathan Karl, chief Washington correspondent for ABC News, is here meeting with President Biden during the Correspondents' Dinner. He was infected at the dinner, as was Secretary of State Anthony Blinken. And the list is starting to grow. Another super spreader event that speakers, including Daily Show host Trevor Noah, explicitly remarked was going to be a super spreader event. Either the bright and beautiful who attended refused to believe themselves capable of the obvious, or courting sickness and even death is the point. Why bother with the public health commons when COVID is a passing inconvenience for the gridiron attendees and like class members with all the access to the latest anti-COVID innovations they could desire? So Paxlovid, remdesivir, dexamethasone, fluvoxamine, molnupiravir, monoclonal antibodies, convalescent plasma, test-to-treat sites, private home nurses, time off, savings, and good baseline health, which the American people at large do not all have as easy access to. Maybe the finger in the eye is exactly the point. Anthony Fauci himself wisely refused to attend the event, diagnosing himself at the kind of risk he refuses to counsel the rest of the country. The callousness on display is remarkable, with the U.S. on the verge of hitting 1 million COVID deaths, almost entirely concentrated in poor and working class communities. Rolling back Roe v. Wade case law protecting the right to abortion serves a similar political two-step. The damage of the reversal is to be borne almost entirely by women without the resources to buy a safe abortion. Clearly, the GOP and their Supreme Court appointees are patriarchal to the extreme, as they were also negligent on COVID. But the Democrats also followed employers' leads in rolling back COVID protections in a way that placed the largest COVID burdens, including the crisis of long COVID infections, on disadvantaged and marginalized populations, Black and brown people in rural communities of all colors, willfully encouraging them risk-taking while also pretending equity remains a central pillar of the party's platform. The present outbreaks of COVID in New York City are largely concentrated in wealthier neighborhoods. For instance, Lower Manhattan and Riverdale in the Bronx, where many people are pretending COVID is over. These outbreaks are likely to spill over into poorer neighborhoods with people without similar resources in health, money, and time off exposed to SARS-2. A people's public health organized around the well-being and welfare of the American people and humanity overall must be moved front and center, and actualizing the democracy the U.S. ruling class pretends it represents. That is my view of evolutionary epidemiology. It's necessary to engage in the kind of understanding and the context in which SARS-2 evolves. The virus isn't just evolving in reaction to concentration of people or anything like that. I mean, it's evolving in response to the political economy on which we find ourselves. And any kind of modeling that we do in that direction must include that greater context. So thank you very much for listening. Have a good day.